Press conference from San Francisco officials giving an update on the spread of the Omicron variant in this city.
To be long, but the reality is we are going to need tests and masks even after this surge of cases eases. None of this is easy, but we're going to keep working together to support everyone in the city. It's how we lead the way during COVID, and it's how we will keep moving forward. And now I'm going to turn it over to Dr. Grant Colfax to talk more specifically about where we are.
Well, good morning, everyone, and thank you, Mayor Breed, for your ongoing leadership during this pandemic. I want to thank San Franciscans for their patience, their steadfastness, their resilience, and their cooperation as we make it through this challenging time. As the mayor stated, we are now at an all-time high in cases, and I want to acknowledge the ongoing and increasing challenges we are facing, at least for this short term. From access to testing, to frontline staffing, to first responders and hospital staff being out due to infections or exposures, to higher numbers of people in the hospital. We are in the middle of the worst of this Omicron surge, but we can, and we should, and we must be looking to the future. Many of you may be wondering what comes next. We have reason to believe, based on data from other parts of the world, like New York and South Africa, that we could be starting to turn a corner soon. But we are not there yet. In fact, let's look at where we are right now. First slide, please. We are continuing to see an unprecedented number of COVID-19 cases, far outpacing any other previous surge, with more than 149 COVID positive cases per 100,000 people here in San Francisco. And just to put that in perspective, our prior highest surge numbers were about 42 per 100,000. Broken down further, it's an average of about 1,250 San Franciscans per day that are testing positive for COVID. And right now, nearly 1 in 5 tests are positive. And it is likely that that rate will continue to increase over the next few days. Next slide, please. And in keeping with these very high case numbers, our hospital census continues to climb. Now, I want to emphasize, given our case rate, these hospital numbers are not climbing nearly at the level that they would have if we didn't have such great coverage with vaccines and boosters. Vaccines and boosters remain the bulwark of our protection against the most serious consequences of coronavirus, including and especially Omicron. I can report that San Francisco mirrors national trends, with a small fraction of those hospitalized with COVID being boosted. And as we know, during the surge across the nation, the vast majority of those who are hospitalized and sadly dying of COVID are either still unvaccinated or are not up to date on their vaccinations. We are optimistic, and you can take down the slides, please. We are optimistic that because of our city's high vaccination and booster rates, we will get through this Omicron surge without running out of those all-important intensive care unit beds. But we also need to think about our hospital capacity in a holistic way. Hospitals support people not only diagnosed and suffering from COVID, but with all other sorts of medical conditions. We need to support these people too, and our medical staff are working hard to continue to do that. This is one way we can think about the future, situating COVID, which we know will be with us in the foreseeable future, into the broader system of diseases and conditions that need our care, expertise, and condition. That is why, as we learn to live with this virus, and indeed, Omicron has shown how important it is that we do indeed learn to live with this virus, that we are focused on hospital capacity far more than case rates. After all, If you are up to date on your vaccinations, it is extremely unlikely you will be hospitalized due to COVID. I want to take a moment to provide an update on testing in San Francisco. San Francisco, as the mayor has mentioned, has been testing at rates unparalleled to any other time during this pandemic. And we've had challenges as well. Our testing infrastructure is also affected by workers getting sick and the high demand on our systems. Our partners and contractors are experiencing that too. And I am very proud of how the city has scaled up testing over the last month. We have more than doubled our testing capacity since the surge began, and now are averaging more than 10,000 tests per day in San Francisco. And in fact, last Monday, we broke our previous record, conducting 17,731 tests in just one day. Our testing averages per population exceed the state average, well exceed the state average. Even still, the demand for tests remains high, and I understand that people are anxious and frustrated. We saw this weekend that happened this weekend with a number of people with COVID symptoms calling 911. It's become apparent that during this surge, we need to take a more robust approach to expanding our testing infrastructure in place to weather future surges. This means widely available and affordable over-the-counter test. And of course, we need all of our health system partners to step up and do their part to meet the needs of their members, staff, and patient. After all, COVID will be a disease that is with us for the foreseeable future. Look, I know this is not how we wanted to spend the first month of 2022, but we will get through this. There are concrete things that you can continue to do to have an impact right now. I'll say it again, please get vaccinated, and please, please get boosted. Wear your mask and upgrade to an N95 or double cloth, or wear a double mask with a cloth and surgical mask. Avoid large crowds and take extra precautions around those who are still unvaccinated, like our young children, and continue to practice safer behaviors around our elderly and immunocompromised. Things will get better. This surge will recede. Let's do what's right for ourselves and our community right now. But let's also think about what comes next. How will we come out of this latest surge? What is Omicron teaching us? This virus is adapting to us, and we need to adapt to living with the virus. We are honing our skills right now, learning how to manage a highly contagious yet less severe form of the disease that will be with us for the foreseeable future. We are seeing where our systems need strengthening at the local, state, and federal level, including access to testing. And we are gaining even more tools to battle this disease, from those boosters to antiviral medications that are just beginning to arrive in San Francisco and that will help prevent severe infection of our most vulnerable. We all have reason to hope. And in this first month of 2022, I am cautiously optimistic that we will continue to learn to live with this virus and come out a vibrant, strong, and healthy city.